know from the experts here their views on what makes a doctor a good doctor. Now we're with the Secretary General of the Saudi Commission for Health Specialties, Dr. Hussein Al-Fayhi, who's also a professor of medicine and a practicing consultant at the King Saud University, so that would give us even more input about the subject. Now, you're very welcome, Dr. Hussein. We're really grateful, and we know you're a very busy man, and descending on you like this, and so Health Watch is very grateful for you. Maybe if I could ask you to give us some introduction as to the functions and the activities in brief of the Saudi Commission for Health Specialties.
First, it's my pleasure to meet you and talk to you and discuss matters regarding health practice in the kingdom and health practice as related to the Commission. The Saudi Commission for Health Specialties is a governmental agency. It is its functions are concentrated on the preparation of health manpower in all specialties, particularly for professional training. Therefore, we have now 40 different training programs, mostly medical, followed next by dental, and we have a clinical pharmacy, and we have other programs in the allied health sciences and nursing. This is the first function of the Commission. The second is the accreditation of health manpower. As you know, the kingdom depends heavily on expatriates for the health practice in this country. And the recruitees, they come from all over the globe with variable training backgrounds, different qualifications, different nomenclature of their certificates, etc., etc. Therefore, the need was urgent and was very important that we have a professional agency which is now concerned with sorting out all the different training backgrounds, specialties, certificates, etc. And this is one of the main functions of the Commission. And we embarked on this function about 10 years ago. The second main important task of the Commission is the health manpower professional registration. Now we are in charge of now the official register for the kingdom for all the health manpower, and it is compulsory and required by all those who are practicing in the kingdom. We started with the physicians first, and then pharmacists, and now it's has been expanded to include technicians and nurses. Also, we are in charge of supervising and governing associations which are very important arm for the Commission to help the Commission to discharge its functions, whether it's for the assessment of recruitees or of establishing rules and regulations regarding the health manpower. So this is in brief what is the Commission all about.
So obviously a wide range of activities, functions and tasks, and the topic in Health Watch today is what makes a physician a good doctor, what makes good doctors good, what makes bad doctors bad. And in that, I'd like to ask you what, in your opinion, as an official, as the head of this organization, as well as a practicing professor at the university, in your own opinion, what do you think are the important qualities that make a doctor a good doctor?
In my personal view, medicine is a science and art, and is an ever-changing and developing subject. Medicine which you learned at the medical school will be different 2-3 years later when you are practicing. Therefore, to produce a good quality doctors, you have to deal with people who are concerned about their profession, who are motivated, who are interested in their profession, and you have trainers who are interested in their profession to prepare and establish good doctors with not only that they are well trained, but they are prepared to be able to continue their development once they are graduated. Therefore, training is important.
Okay.
The motivation and the interest of the practicing health manpower is of utmost importance. Those who are in charge of the rules and regulation of health malpractice are also required to have rules to push people to continue their development and their training. That's why now we have linked the professional registration with compulsory continuing medical education. Now all those who are practicing in the kingdom now and who are registered with us to renew their registration, they must present us with a number of continuing medical education. That is only a part of to make a good doctor a good doctor.
Okay. So the training
but as I said, it is important that the individual themselves, they are aware of what's going on around them, that they are aware that medicine is changing, developing. We have to deal always with the new practices, new skills, new procedures, new science, and therefore they have to keep abreast of what's going on in their profession. Otherwise, they will be really left behind, and they will be rusted, and they probably would lose really the grasp of the to practice.
So if I can summarize what you said, obviously background training is very important.
That's all.
And, keeping abreast with medicine is very important.
That's
what would you say to the public? If someone asks you, doctor, how can I tell a good doctor from a bad doctor? What would you say to them?
An individual, a lay person, it's probably going to be difficult for them to judge the ability and the capabilities of a doctor. But the reputation, of course, is very important.
Okay.
And those who are good, they make good names, and the word will spread around. They should make sure that those who they seek, they are qualified and they are professional, properly assessed by the commission and registered as well. I think that's gives them a minimum, at least, of security that the doctor they are seeking help from is at least, to be qualified.
Okay. Can I ask you then the question a different way? What do you think makes some patients dissatisfied with the doctors? Is it, for example, that they are unapproachable? Is it, for example, that they don't have the time, they don't listen to their patients? Is it their bedside manners? What makes patient change doctors?
I think doctors, like any other humans, they have two sides. One is the side of the profession, the skills, the knowledge, and the other side is the human touch, is the human nature. If the doctor understands the needs of a patient, understands the mentality of the patient, the psychology of a patient, and that patients want to become sick, they are different from when they are healthy. So if you really understand them, if you cater for their needs, if you communicate with them. I think now communication is of utmost importance, and now it's being really stressed, and even our commission now making it compulsory now for our trainee doctors to take a workshop in communication. So I think you should not really ignore this human touch, human needs, the psychological aspects of the practice. So you have to understand the patients, their mentality. You have to pay attention for the patient, their relatives. You have to explain to them in a simple words the problem, what you're going to do, and think if you can explain the patient all the steps which you are taking, if you encourage the patient even sometimes to seek other opinion, if you show them the confidence in yourself, you're going to gain patience. But if you deal with them like we're dealing with a machine, with arrogance, with ignorance, without really paying attention to their needs, to their mentality, to their sensitivity, you're going to lose patience.